Before we get started, I do have a few housekeeping items I wanted to go over. I have everyone muted at the moment just to cut back on feedback. So if you have a question, you can either raise your hands on the GoToWebinar toolbar, which is over on the right top of your screen, or you can always type your question in and it will notify us. Also, we will have a Q&A session at the end if you want to wait until then. All right. Finally, we are recording this webinar, and at the end, I will email out the presentation to you, so don't feel like you have to copy all of the information down quickly as we go. I will send this out, and so you can just kind of sit back and listen and learn, hopefully. So, right. With that, I also wanted to mention that our next Ask an Expert webinar will be held just in a couple of weeks on June 9th, and we'll be talking about common insurance headaches, which I'm sure many of us can relate to. I also wanted to point out that we are holding monthly support group calls, both for parents and caregivers on the third Tuesday of each month, and a separate call for adult patients on the first Wednesday of each month. And it's just a teleconference. You call in, you can participate, or you can just listen if you're more comfortable with that. But I would encourage you to find time to call in to at least one and just kind of see what they're all about. I feel like they've really been helpful for many of our patients and caregivers. All right, so what to expect from this evening's webinar, transitioning from a pediatric to an adult nephrologist. We'll talk about the differences of pediatric and adult care, transition challenges, the elements of successful healthcare transition. We have tips and tricks to finding a good adult nephrologist, and then at the end we'll talk. We'll take questions and our experts can answer those, and then we have resources. And again, when we get to the resource page, don't feel like you have to jot everything down. I will send you the presentation. So with that, I'd like to introduce our special guests. First, we have Dr. Elaine Koo on the line. She is a pediatric and adult nephrologist and runs the Transition Clinic at University of California in San Francisco. We also have a young adult patient, Amanda Grandinetti, who has recurrent FSGS and has successfully completed her transition from pediatrics to the adult side of things. So we're looking forward to any input she can give as we go forward. So with that, I will let Dr. Koo take over. Welcome, Dr. Koo.
Hey everyone, thanks for joining this evening. I'm going to share with you some of the challenges sort of with the transition period, and certainly ask for Amanda for her input, and feel free to ask questions. I think the transition period is a challenge for patients, families, and providers all around, and it's one that takes a lot of work but can be done well with the proper sort of planning ahead of time. So first, just some of the differences between pediatric and adult care. I think when you're in a pediatric environment, and as a pediatric nephrologist, we know that a lot of care is very much supported and monitored by patients and healthcare providers. If you don't show up to clinic, usually someone will call you and follow up with you and see what's going on. We typically help coordinate a lot of your care with your specialists and work in much more of a team approach. Oftentimes in the pediatric nephrology clinic, you have access to dietitians and social workers who can help advocate for your care. So there's just a lot more support, and the amount of time that is available for providers to dedicate to each and every individual patient is much more than an adult setting. And typically pediatric patients have insurance either through support from Medicaid, or parents have private insurance that support the patient. This is very much in contrast to adult care. It to be much more independent and a self-advocate for things that you may need. Certainly in adult care, it is the expectation that your primary care provider will coordinate all of your care, and a lot of times you need to obtain referrals to see other specialists from your primary care physician. So as an adult nephrologist, it's very difficult for me, for example, to refer you to ophthalmology clinic if you need to see an eye doctor. That all probably needs to come from your primary care, depending on your insurance, but that's usually the model. Adult patients also often need to advocate for things that they need. Oftentimes there aren't as many support staff or dietitians in the clinic or social workers in the clinic. And most importantly, adult patients do need to find their own insurance in order to help financially support the care that they actually need, and these are some of the challenges. The number of adult patients with kidney disease is much higher than it is in pediatric care settings, and so the number of minutes, for example, dedicated to each patient per visit is typically much lower. And the expectation on this system is really that adult providers see patients in follow-up every 20 minutes. It makes it very challenging then to sort of set aside more dedicated time that a pediatric patient might be accustomed to in their care, and these differences make it a little bit challenging during the transition, especially if sort of taken abruptly. I know, Amanda, if you have any other thoughts or comments.
No, that's pretty spot on. I think it often depends on what kind of hospital you're at. I have a transplant, so a lot of my care is actually through the transplant clinic. So they're kind of my primary care. But other than that, I would say it's pretty spot on.
Yeah, so it's definitely different depending on which program you're in and what kind of transitional or formal transitional program you have access to, and what your care needs are, but that's in general sort of the expectations. And certainly I think in my experience, most adult providers do want to try to provide care and support. It's just that the number of patients per provider, the ratios are a little bit different, and so as patients move over to adult healthcare systems, it is important that they have skills to self-advocate and speak up when they need something, only because, you know, there's less sort of attention that can be paid to per patient. So self-advocacy is important. I guess we'll move on to the next slide. So there are many challenges to transition that can definitely be overcome, but I think knowledge will sort of empower patients to prepare for some of these challenges and figure out ways that will best smoothen the transition to adult healthcare systems. So for patient challenges, certainly there are many challenges happening at one time. This is a time when most patients are going to either college or starting new jobs, perhaps to different locations, and oftentimes away from caregivers or parents. Certainly there are new responsibilities that the patient is expected to assume. Patients, when they go to care settings, are really expected to be able to relate their own medical history, the complications of their medical history, and answer a lot of questions that perhaps in the past parents or caregivers have really been responsible for answering. And then healthcare costs are really assumed by the patient at this point. So one of the major goals of our transition program is really to make sure that patients learn a little bit about insurances and have some idea of how they are going to be able to support their health care costs once they are over the age of 18 or 21. For families, this is a challenging time as well. Certainly, many families and patients in our pediatric clinics we've actually known for many, many years and have a very close relationship with. We know what the name of your dog is, for example. And so I think many families feel very much tied to their pediatric caregivers. Getting used to the fact that the patient is becoming an adult and at age 18 has much more privacy and rights, certainly, to confidential information is something that families need to get used to, and we work with in terms of addressing these issues at age 17 and asking patients sort of, you know, what model do you want when you become an adult? Do you want us to primarily share information with you, and then you share information with your parents that you would like to be shared? Versus you would still like your family involved in everything, and different patients are at different stages in terms of privacy issues, and that's something that we discuss. And certainly I think parents and caregivers very much struggle with this transition because they've been so involved and oftentimes for so many years that it's sometimes difficult to allow the adolescent to really develop independence, but I think it's extremely important for the success of this transition to be able to allow the patient to make mistakes and learn from their mistakes and learn how to become independent during this process is critically important for its success. And mistakes, you know, in a supervised setting where if they do make a mistake, the provider and the parent sort of steps in and intervenes, I think are sort of good experiences for the patient so that it's not abrupt as they transition into adult healthcare systems. And then certainly for families, you know, being very much scared about the healthcare transition to adult providers is very, very common. A lot of times families have been told many things about the adult medical team and how they might be different. But I think that just sort of knowing what to expect is important, and meeting your adult medical team ahead of time will sort of make some of those fears a little more palatable as time goes along. And the adult medical teams, for the most part, I think, are very much invested in the success of the transition. And they very much want to work with patients. And, you know, this can actually work, but it's definitely challenging for families. I think for our team on a pediatric medical side, certainly part of the issue is that it's very hard to let go of families and patients that we've known for so many years. Depending on which setting you're in and what kind of arrangement in your medical setting you have, there may or may not be a lot of contact with the adult providers that you're actually going to transition to. There is definitely not very much medical education that's focused on transition, which certainly in medical education we've been working on to try to educate about the transition process and taking care of patients who might have had chronic illnesses since childhood. But it's definitely a challenge. And that handoff is something that we at our center very much try to work on so that things are smooth for the patient and families. And then speaking as an adult nephrologist as well, certainly it is challenging to receive a patient who's had many, many years of medical history to learn everything that's been going on prior to the transition. To manage diseases that might not be typically part of my adult nephrology clinic, which is very much focused much more on diabetes and diabetes-related kidney disease. And then certainly as a adult provider, we always struggle with the limited time that we do have to spend with patients, but oftentimes that can sort of be overcome with more frequent visits over time. I think, I don't know, Amanda, is there anything else that you would add as a challenge?
No, I think the patient challenges was one of the scarier parts for myself. I actually transitioned when I was 21 and I was starting dialysis, so there was a lot of uncertainty, and I think going off what you said, to learn and advocate for yourself as well as learn the process to get rid of some of those fears will certainly help the transition.
Yeah, I think definitely knowledge is super important. It's always scary for everyone involved, the adult provider included. But, you know, just learning about the things that you might expect and knowing condition will definitely help that transition process. Let's move on to the next slide. So what can help smoothen the healthcare transition? One is really understanding very early on what the clinic policies are for transition. Does your provider routinely transition all patients at age 18 versus age 21 or older? That will sort of help you develop a time frame in terms of when you as a patient and your family may want to work on some of the transition skills that are important to foster success. Then once you know sort of time frame that you have to work with, preparing for that transition is super important. And I think that comes both from the patient and family side as well as the pediatric provider side to really teach and empower patients so that they will do well during a transition. In our clinic, we certainly do create a plan of action. At each visit, we set goals for the next visit about things that we would like the patient or the families to be able to accomplish. And most of these are steps towards independence, which I think we have a slide coming up with. And then completing that transition process, most important of which I think is really some sort of one-time communication at least between your pediatric team and the adult team that is about to accept a patient, which can really help alleviate the fears of all parties that are actually involved. Let's move on to the next slide. I think there's some more about preparation. So certainly first, inquiring your provider about their transition needs and what kind of resources they have in place to help with their transition, I think is very important. The recommendation is really to start the transition process at about age 12 or 13. Which seems early, but it's really something that I think is very important, starting to help the adolescent learn a little bit about what their disease is called, you know, what the actual pathophysiology of the disease is, what procedures they might have undergone, why did they take the medications that they actually take. I think those are all things that can start at a relatively young age, actually, in very simplistic sort of terms. But really pinning your team down about when that transfer to adult care is expected to happen is important, because it gives you some idea sort of a time frame that you have to work with your pediatric team to make sure that you have all the elements of success. And then we can move on to the next slide. So preparing a patient has many steps. Certainly, I try to introduce very on the importance of self-management. Understanding the disease, I routinely do quiz my own patients about what is the name of your diagnosis, what kind of symptoms might you have if, for example, your transplant doesn't work anymore, why are you taking this medication, and what might be some side effects associated with medications. Those are things that we slowly introduce at a relatively early age. Then as the patient begins to learn more about their disease process, certainly our policy is that we begin to ask patients to have certain responsibilities and tasks at each visit. Sometimes that might be as simple as you need to fill your own pill box, or you need to set an alarm to remind yourself to take your medications and not have your parents do it. A lot of times we work with patients about what symptoms might warrant a call to your physician or going to the emergency room, such as fevers and a transplant. And then a lot of times we work with patients regarding scenarios in which there might be how they're going to handle it. For example, what are you going to do if pharmacy tells you that you can't have a refill yet for this medication, but you're out of medication? So we, in our clinic, have scenarios where we work with patients through cases almost and see what patients say they would do with certain sort of scenarios to help them learn self-management skills. And then as time goes along, the patient may, for example, not have refilled their medication until they're down to their last pill. And if they tell us that, we'll work with them about, next time, what can we do better to avoid these sorts of situations. Very much starting in the teens, I would say, at our clinic, we try to have a portion of the visit without the parent, and that's really more to engage the patient in answering questions on their own and talking to their doctor themselves. And that will help sort of the patient learn more independent skills as they move along into adulthood. There are many tools out there that actually can help assess readiness, and I think a lot of these tools are actually online. At our clinic, we do use a modified form of the Transition Readiness Assessment Questionnaire, but there's a variety of other self-management and self-advocacy questionnaires that are very much age-specific and age-appropriate. And then we try to identify areas where patients or parents feel like they don't have enough information or knowledge about. And the other area that we at our clinic particularly like to target are areas where there's a discrepancy between either the parent or the patient's assessment of their own readiness and the provider's assessment, because sometimes those are areas that actually needs the greatest amount of work. Amanda, do you have anything else to add?
No, I do not.
Okay, next slide. So this is an example of sort of age-appropriate tasks at each visit that might be appropriate for patients to discuss with their physicians and physicians or providers to discuss with the patient, starting with very simple things such as just knowing your diagnosis, knowing how to remind yourself to take your medications and learning your medications, all the way to really managing all aspects of your care at age 18 or above, refilling your own medications, calling pharmacy, dealing with insurance issues. And then in our clinic, certainly knowing a little bit about your own creatinine and what it should be if you're a transplant patient, and what you're looking for on lab results and why we get labs so frequently is something that we work on. Next slide. And this is an example of a transition readiness assessment tool. There are many tools out there, some of which have been actually validated in larger studies, but we actually have a coordinator in our clinic, and we go through questions for the patient and have them assess whether or not they can do each of these skills, such as filling their own prescription, having a way of paying for their copays for their medication or for their visits, knowing whether or not they're taking their medications correctly, knowing when to start reordering their refills for medications, if they need other supplies, how they're going to get the supplies and who's responsible for ordering them, and then how you're going to actually pay for that equipment now and also in the future when you're over the age of 18. Next slide. Well, yes, Amanda, I don't know if you had any of these readiness assessments when you were younger.
You know, I actually didn't. I was diagnosed when I was 14, so I was kind of where I would, you know, kind of already receiving or doing some of those tasks that you already mentioned in some of the previous slides. But for me, it was kind of, and that was 12 years ago. So I kind of had to learn really fast. I didn't have a lot of help. There wasn't a lot of information on FSGS, let alone how to help a child transition. So I kind of took it amongst myself to learn how to manage my care since there wasn't a standard of care. So that kind of helped me, and I think it also will kind of depend on what kind of person you are. I was kind of always independent, and I do work in healthcare, so a lot of these tasks are understanding of some of the things that you have to do come to me naturally. But yeah, I was kind of left to my own devices. I had to do it all on my own.
I think you make some great points. So one is that I think the recognition of the need for transition and formal transition processes has certainly grown over the last decade, especially you know, with sort of more recognition of some of the consequences of poor transitions. And two, I think what's really important, what I do in sort of a day-to-day basis, is really assessing the type of patient that you are. I think a lot of these transition issues are different for different types of patients. Everyone handles sort of the transition process a little differently, and there are certainly some patients who need very little help, are very independent from the very beginning, are very knowledgeable, do everything right. And then there are patients who need a lot more hand-holding, a lot more time to prepare for the transition. And so, you know, we try to sort of titrate how much transitioning we actually do in our clinic to the patient. And then we also adjust the age of transition to sort of match that. But every healthcare setting will be a little bit different. So tips for parents for the transition process, I think definitely getting medical records organized is very helpful. Any adult provider that you go to will ask you to have medical records that they can review and understand your history from. Starting to get your child involved very early about, in terms of teaching them about their disease process is important. A lot of children's hospitals do have teen or adolescent clinics where they often see patients even beyond the age of 21. So that's actually a really good resource, and they can serve as your primary care provider and a bridge during the transition process. So that's something that I would highly recommend. Involving your teen in all health-related discussions, I think, is very, very important, and allowing them to have some leeway in terms of choices, even if it's just, you know, do you want to draw your labs today versus tomorrow. I think those are things that help the teens to slowly take more control over their health care, and gets them involved in the process. Allowing teens to develop their self-management skill is also very, very important. A lot of times as parents, we certainly want to do everything for our kids, make things simpler for them, but I think letting them do a lot of tasks actually helps prepare them for the transition, such as calling in their own medications for refills or rescheduling their doctor's appointment if, for example, they have to take a test that day and they can't make it. Those are basic things that I think the patient really needs to learn how to do during this transition process, and to let go of some of those responsibilities and allow the patient to take over. Encouraging teams to monitor their own treatment needs is important, and getting them to fill out flow sheets, blood pressures, if you're taking home blood pressures, for example, keeping a notebook is certainly a good habit. And then really developing coping skills to address problems is something that is critically important, and something that we try to work with our patients about. But I think what's really, really difficult for many parents that we see is really letting go, and we totally understand that. It can be extremely terrifying to let go, especially because care can often have been very complex. But I think to really foster that success, it's really important to slowly let go, and it doesn't have to be abrupt. It can start way before patients actually reach adulthood. But that's really the best way to help make sure they continue to succeed in their health care as adults. Next slide. So planning, super, super important, as I've already discussed and emphasized many times. Kind of coming up with a plan, a checklist of goals and expectations prior to transport is important. I do like this portable health summary, which you can actually find many examples of online. Basically what it is just name, age, allergies to medications, current medications that you're on, past medical history, past surgeries that you've had, past procedures you might have had. But it's nice because it's something that the patient and families can have and carry everywhere with them, such as the emergency room, should there be an emergency, or new healthcare providers that you actually meet. Developing an emergency plan, is important. So asking your providers to sort of go over what kinds of situations would be emergencies and what you're going to do if that were to happen. But probably the most important process during this transition is really understanding your insurance coverage. It is one of our greatest challenges, is to make sure that as patients move into adulthood, they apply for insurance or get insurance through schools, through their employers, because a lot of times we find that the greatest challenge is that some of these patients will lose insurance once they turn 18 or 21. That makes it difficult for them to get the care and the medications that they actually need. And then identifying potential adult providers once you're actually close to the age of transition is also important. I think we have another slide about that. Is there anything else, Amanda, that you would say is important in planning for transition that you've learned yourself?
Really just to have that educational understanding early on, and for the parents to understand that the earlier you start setting those habits, the child will carry that through their adulthood, I think was really important. So I can go over some things at the end that I do to organize my care and to make it easier. The insurance coverage is actually an interesting topic, because a lot of states you can have coverage until you are 25 or until the day you turn 26 under Obamacare. So I actually, it's funny, I went through this transition again. You think you're done with it, but I actually went through it again last year because I had to get my own adult coverage because of the law. So it's definitely always a learning experience whenever you have a chronic illness.
Yeah, I totally agree. And I think certainly with Obamacare, things have gotten better. We used to have a lot more challenges in terms of getting insurance covered after age 21. But even then, I think the process of sort of applying and just figuring out, what are your co-pays going to be as an adult is sometimes it's very scary, but something that I think is important to plan for. Let's move on to the next slide. So finding an adult nephrologist, there are many ways that this can be done. I think for most pediatric patients, your best bet is probably a referral for your pediatric nephrologist, but if your pediatric nephrologist is not in the geographic location around your house, or where you live, then that can be a little bit more challenging. Talking to other patients and certainly contacting Nepcure are options. Setting up an appointment to interview an adult nephrologist is a good idea, depending on which healthcare setting you're in and whether or not that nephrologist is available to do the interview. But even then, just trying to go and meet them at even a formal clinic visit and seeing if you actually like them a little bit before you're actually expecting to transfer your care might be a good idea. And then when you do go see adult providers, your visits are probably going to be a little bit shorter than they are with your pediatric provider. So having a list of questions that you wanted to ask or symptoms that need to be addressed ahead of time can actually really help streamline the process. And then asking at the initial appointment who you should contact for questions is important. And then before picking the actual nephrologist, you do want to make sure that they will take your insurance. And it will take some time. It's a transition process, so it will take some time for your adult nephrologist to get to know you and for you to establish the relationship with them. Remember, in pediatric nephrology, you probably established your relationship over many, many years. And so it will take a little bit of time for you to get used to your adult nephrologist, and I think that's normal and that's okay. You may not love them as much as your pediatric nephrologist the first visit. But over time, I think as they get to know you better, you can certainly establish very similar relationships to what you've had in the pediatric world. Next slide.
Dr. Koo, we actually...
Oh, I don't know, Amanda, go ahead.
Go ahead. Okay, we actually have a question I thought would fit well with this slide. Would you suggest a meeting between the pediatric care team and the new adult care team?
I would, but I think depending on where you're located and what the healthcare setting is, it can be very challenging to get everyone to meet in the same room. At our center, that is what we do, but we are a little bit unique in that I am both pediatric and adult trained. So what typically happens is the patients sort of follow me to the adult healthcare setting, and then I introduce the patient to their adult transplant nephrologist, for example, if I'm going to transfer the patient. So we do meet together. I think it's a great idea. A lot of times patients do feel more comfortable if their pediatric team is also there, but sometimes it can be hard to coordinate. The other thing that can help is even if there's not an in-person meeting, a lot of times the pediatric nephrologist can try to contact the adult nephrologist and give a phone or verbal introduction to the patient. And that way when an adult nephrologist actually meets the patient, they already have some idea of what's going on, a little bit about the history, and that can help smoothen the transition process as well.
Great, thank you.
Next slide. Yes, I think this slide is very important. So transitions are always a process. They do take time. I think it's really important to be patient. It won't happen overnight. It's totally okay to look at the plan, decide what needs to be changed, what needs to be done better, and to revise the plan. But planning is important and patience is important. I'd be happy to answer any other questions, or Amanda, I think if you wanted to tell us a little bit about some of your experiences or tricks that really work well to help make this process smoother.
Yeah, I can just go over some things really quick so we can take questions, but like I said, I do have a transplant, so my care is going to be a little bit different than someone who doesn't have one, but I would say don't be afraid to also get second opinion. For me, I was transferred to a clinic that was where my pediatrics specialist transferred me to, and I wasn't a huge fan of the care, and I actually went on and did some interviews with other specialists, and I am at a hospital right now that I actually really love. I actually did sit in a room and interview the surgeon to make sure the care plan that they had suggested for me was what I wanted. So I always suggest look at all your options, and like you had mentioned, reevaluate the plan. I have a number of things that I do to just make things simpler. Like I have a scale by my door with a dry erase board. I have business cards of all my doctors. I take a journal with me to write my symptoms down daily so I don't have to rely on my memory checklists. I keep in my phone. I have clinic every 4 months, so something might just pop in your head one day and you want to go ahead and write that down, otherwise you might forget it. I have 2 very large pill boxes. I fill them 2 weeks at a time. Just little things like that that might take the stress out of daily tasks and to remain organized, I think are really helpful.
Great. Thank you, Amanda. I really appreciate it. I think I might take your advice on that 2 weeks pill box idea. Because it's like one of those mundane things that come around too often when we just do it weekly.
Yeah, it really does.
Another question that we had, Dr. Koo, is what are common mistakes that new adults make as they transition into the adult healthcare system?
That's a great question. I think I think it really depends on the patient, but I'll tell you what some of our common or the common things that I've seen are. One is that the adult will show up at their first visit with the adult provider, and they will have waited 30 to 45 minutes in the waiting room, and they will get upset and leave without seeing the provider. You know, for example, that's one of the differences between pediatric and adult providers. Adult clinics are extremely busy. We see a much larger number of patients per provider ratio, and so I think patience is really important. 2, I think a lot of patients often go to their adult providers, sometimes with their parents, sometimes without, but don't have a set of sort of questions that they want to ask or symptoms they want to have addressed ahead of time, and oftentimes don't advocate for themselves in terms of things that they actually need. And I think it's important for you to be prepared, and when you do go to your visit, have, you know, the agenda or list of things that you really want addressed so that your provider can actually help streamline your care and get you the things that you actually need. 3 is that sometimes patients are too shy to ask their providers to help them with certain things, and a lot of times as a busy adult provider, we won't know unless you actually ask, right? We really do want to help, and I think that's true of most adult providers, but if you don't ask, oftentimes we won't know about things that you actually need to help you succeed. I think a lot of times people or some adults will feel, young adults will feel like the visits are relatively short and that their adult providers aren't, doing much for them, quote unquote. And I try to really lay down sort of the expectations ahead of time when I see my young adult patients, that I know the visits aren't as long as pediatric ones. But the visits are still incredibly important. We are evaluating every single time, blood pressures, whether or not you look swollen. We're doing physical exams, looking for changes in your clinical status. And I think for busy young adults, a lot of times the assumption is that, it didn't seem like the doctor did much for me, but we do a lot in that short 20 minutes that helps make sure that the patient stays healthy. And I think those are sort of some common misconceptions, and the young adult may decide that they don't want to come back to the doctor or won't see the doctor very frequently anymore, and those are often times when things will be missed, such as acute rejection if you have a transplant, for example.
Great. Another question, would you recommend parents to accompany their children to the first meeting with their adult care provider?
I think that this is sort of part of the transition, is really asking the patient what they would prefer. These are young adults. They certainly, we recognize that they have increasing rights to privacy as they become young adults, and I think the young adults' opinion is probably the most important one. If you are going to accompany your young adult to the first visit, I would suggest that at least for part of the visit, you're not in the room. One, so that any sort of confidential healthcare issues that might arise that the young adult wants to address without you in the room can be addressed. But two, again, sort of to help that transition process where the young adult is able to answer questions that a provider might pose themselves, and talk about their own sort of symptoms or medical issues themselves. So I think it's really up to the patient, and it's very patient dependent and family dependent.
Okay, very good. And then there's a question here from Lori that I can actually answer. Her question is, does NephCure have a list of recommended adult nephrologists that specialize in FSGS? And Lori, to answer your question, yes, we do. We're not able to publish that list, but if you shoot me an email after the webinar, we can definitely talk and make suggestions. But keep in mind, too, that different doctors appeal to different people, so it still might not be a great fit even though they're NephCure recommended. But we definitely do have certain doctors and facilities that see a little bit more FSGS, especially in the adult side of things. Adult nephrologists don't necessarily see a high volume of FSGS patients because, as Dr. Koo mentioned, they're pretty inundated with other types of kidney disease, particularly caused from diabetes. So it's definitely worth looking into, and I can help you with that. Does anybody else have any other questions for Amanda or for Dr. Koo? You can go ahead and type those or raise your hand and I can unmute you. Okay, well, I'll go ahead and share some resources that we found kind of preparing for this webinar. I won't go through them all because I'll email them out afterwards, but gottransition.org is probably the most comprehensive place that talks about this topic and kind of goes through both sides from the practitioners to the patients. If you're looking for something more that leans more towards the kidney side of things, the NIDDK also has a little bit of information about transitioning. A few of these links also have copies of the transition plan of action that we had shown earlier, and there's actually literature on transition, and just a few more documents there. We also have a section of our website, nephcure.org, that talks about managing your care. It has tips and tricks of questions to ask your nephrologist, how to prepare for your clinic appointments because they are so short as an adult, and also keeping a health record is in that section as well, which is very helpful. So if anybody else doesn't have any questions, Dr. Koo or Amanda, do you have anything else to add?
I don't, but if anyone wanted to reach out and ask a patient, I'm sure Kelly can feel free to give out my contact information or connect us.
Great, thank you.
This is true for me as well.
Thank you very much. Very generous. I really appreciate you, Dr. Koo, and also Amanda for joining us and giving of your busy schedules to NephCure and being there for our patients and helping us through this sometimes tough topic. And I think I can speak for everyone that this webinar was very informative, and we just really appreciate you. So thank you very much. And also thank you to all of our patients and patient parents who attended. We appreciate you as well. And I will follow up in the next day or so with the presentation, and feel free to reach out if you have if you think of any questions later on. But I appreciate everyone joining us, and thank you very much.